We're going to begin with Ryan Belmore of What's Up Newport. Governor, he notes there's a lot of confusion on when wearing a cloth mask is required and when it's not. He asks, have you considered simplifying the message for understanding and enforcement? For example, requiring everyone to wear a mask at all time when in public.
It's a great question, Ryan. And tomorrow we're working on an executive order right now as it relates to face masks, and just trying to get it right for the exact reason that you have said there, to make it enforceable and in the best interest of every Rhode Islander, and frankly, practical. Here's what I will say. The reason I'm going to have to do that executive order is that at the same time that we're going to start relaxing the stay-at-home order and letting us go out a little bit more and stay close to home instead of at home, I'm going to have to be doing more things like additional restrictions, including mask wearing. So if you can hang on for a day, I'm going to sign the executive order and announce it tomorrow. But here's what I will say, and I thought Dr. McDonald did a great job of this yesterday. You really, at this point, we should all always have a mask on us. So if you're going for a walk by yourself, or with someone, with whom you live, and you're in the woods and no one's around, well, you don't necessarily have to wear your mask, but you may run into somebody, and so you better have it on your person. Certainly, if you are going to work, while you are at work, while you are at the grocery store, while you are any place out of your house and not really alone in nature, you need to have your mask on. And so, again, we will clarify it with a new EO tomorrow, but I hope that helps for now.
Bill Bartholomew asks, I've been hearing very different reactions about your guidance and actions in recent times from Washington County versus Providence County from their listeners and readers. What is your message to those in less impacted areas about protecting the state as a whole?
Thank you for the question. So I have thought a lot about this. And when you look at a much bigger state, for example, I was just talking to the governor of Colorado. Colorado is a huge state, and Denver, he has kept the stay-at-home order in Denver, but for more rural places, he started to relax the stay-at-home order. In a place like Colorado, where there are many hundreds of miles in between the states, I think that might make some sense. In a place like Rhode Island, which is the most densely populated state in America, where you can get anywhere, really, in 30 to 40 minutes, where we don't have a county government, there's no real county government, it's a state government and municipal government. For all of those reasons, I did not think it was a safe or appropriate approach to do a county-by-county relaxation. We are a small state, a proud state. We're one state. We're effectively one community. And so I decided, after a lot of thought and consultation, that what was in the best interest of all Rhode Islanders was a single statewide approach. More than 50% of our GDP, of all the economic activity in Rhode Island, is in Providence, which means that even if you live outside of Providence, chances are you're going to be in this area. So again, I did what I thought was in the best interest for the conditions in Rhode Island. And that, by the way, is something you're going to hear a lot from me. Density is the worst thing for this virus. Montana and Wyoming are in a very different place than Rhode Island. And I'm going to protect the people of Rhode Island the best way I know how.
Our next question comes from Michael Bilo of Motif Magazine. The New York Times is reporting that the federal government internally estimated the national deaths per day to double to 3,000 by June 1st. Rhode Island seems to be defying that trend so far, but can it escape being swept along?
Let me say two things. Yes, we are doing very well in Rhode Island because of the choices we've made and because the people of Rhode Island are doing an amazing job. I just said we had 95% compliance with mask wearing this weekend in our retail shops. That's fantastic. If we, the people of Rhode Island, continue to follow the rules as we are now, we, all the people of Rhode Island, will be safer, healthier, and spared some of these terrible consequences. Having said that, the bad news for us is we're stuck between two hot spots. As Dr. Deborah Burke said, Rhode Island is unfortunately stuck between two incredible hotspots, otherwise known as Boston and New York City. So, and as I've already said, we're very densely populated. We've done an excellent job, and that's why we are where we are. It's why you don't see hospitalizations and mortality shooting through the roof, and we're going to stay on that path, being flexible and adjusting as required.
Brian Crandall of NBC 10 News says state police are working an investigation on fraudulent unemployment applications in Rhode Island, and the U.S. Attorney's Office said it and the FBI are involved. What do you know about the extent of the fraud? Were there enough checks and balances at the Department of Labor and Training?
Yeah. So I can confirm that there is this investigation. And I can confirm that the FBI and the U.S. Attorney are involved, and I would ask you to direct your questions to them, because I can't comment on ongoing investigation. As to were there enough checks and balances, we are obviously looking into that, but my answer is yes. And this situation has more to do with the ability of bad actors to engage in bad behavior than it does to do with our checks and balances. If and as I'm allowed to say more, I will be saying more about that in the days to come.
Tara Granahan from WPRO Radio says, how are you ever going to be able to monitor every office, restaurant, and retailer for Phase 1 restrictions? And if they violate, what are the consequences?
Yeah. So a couple answers, and you make an excellent point. We're going to have increased enforcement. We will have more inspections, more people at DBR, more people at the Department of Health, more state police, more local police. You know, we're gonna amp it up to make sure people are complying. As it relates to consequences, as I said earlier, later this week, I'm going to be very clear around, which of these things are guidelines versus which of these things are regulations, and if they're regulations, what are the consequences for not complying. But also, we are going to be relying on industry organizations to help police their own industry. So the best example of this is the pledge that manufacturers have taken. They got together as manufacturers to say, we pledge to operate according to these new rules. We're working on a similar thing with the construction business. Every construction site, we want them to sign a pledge, these new rules. We may do a similar thing for retailers, restaurateurs, and hairdressers. Because here's the thing, it's in their interest that all of their peers follow the rules. Because if people don't follow the rules, and I have to, again, shut down the whole industry, that's bad for everybody. So the whole time I've been up here, I've been saying, look for ways to comply with the rules. Don't look for ways to get around the rules. And the truth of the matter is that's in your best interest, because if you start to cut corners, everyone else is going to suffer.
Our next question is from Tanya Signori of the RI Echo. As for federal money and loans, some small businesses and restaurants were not able to receive money. Is there a way that future money can be given to those businesses first?
Well, first of all, it's important to note that the PPP program, the Federal Small Business Administration PPP program, it's still in effect. It's not too late to apply. Now, the funds are getting exhausted rapidly, but it's still open at the federal level. So if you're looking to the Paycheck Protection Program, my recommendation is that you email Commerce at ppp@commerceri.com. We have been in dialogue with lenders locally and nationally that are opening up spots in their application process for the unbanked small businesses of Rhode Island. So please email ppp@commerceri.com. The governor has emphasized our focusing upon unbanked businesses and making sure they have a shot. So we've been helping small businesses process for weeks, and there are still opportunities to avail yourself of these resources. Now, having said that, can we help to prioritize smaller businesses going forward? Yes, as a general matter. Governor Raimondo has already been advising us and guiding us as we think about our stimulus dollars, the CARES Act dollars, to think about smaller businesses, and we'll have more to say about that when the governor is prepared to make those remarks in coming days.
Kim Kalunian of WPRI has the next question. With Rhode Island opening, is there any concern around people coming into the state from Connecticut and Massachusetts to visit our shops and restaurants?
Yeah. So it's a great question, and the answer is yes. I'm going to be back later this week with some detailed guidelines on how we intend to handle travel in phase 1. So if you hang on a day or two, I can answer that more completely. But let me say this. If our shops are abiding by the rules, they'll never have anyone in there that's within 6 feet of each other. There'll be very limited browsing. So again, I'm going to have guidance on travel, but at the end of the day, the whole thing is avoid crowds, stay at home if you're sick, wear your face cloth covering, extra cleaning. And that is what is going to be very important. And that applies to somebody coming from Massachusetts to one of our shops.
Sophia Rudin of the Public's Radio notes, according to state payroll records, since August of 2015, the position of Chief Medical Examiner has not been filled except in an acting capacity. Why have you not filled this position?
We've worked very hard to get this position filled. We know that the examiner's office within RIDO's state health laboratories plays a critical role in the work that we do. And we really credit the commitment of those who have been in the acting role for the amount of time that's needed. They're engaged with us and fulfilling every element of the capacity needed. And we are continuing to be as creative as we can to attract the long-term, competent, strong leader that we want to continue to maintain in the Chief Medical Examiner's role. Know that we've done many, many interviews and are continually focused on getting this role filled.
Doctor, our last question is from Shannon Heggie. Are you now seeing people who have been in the hospital and the ICU for quite some time pass on? Could that lead to higher death rates in the coming days? And how long, on average, are people spending in the ICU before either getting better or passing on?
Yeah, this is an important question. There can be a time frame in which people who are in the hospital have lingering of their illness, with many of them ultimately getting better, and some, sadly, ultimately not getting better. For that reason, hospitalizations, we have shared, can be a lagging indicator. It takes time, several days after someone is infected with the COVID-19 coronavirus, they can end up in the hospital. And then oftentimes several days after that, we would see an unfortunate death if there is someone who does not recover. The amount of time can vary, on average less than about 2 weeks or so that we are seeing, and we're continuing to work closely and really appreciate those in the hospital, on the front lines, in our intensive care unit, who are doing everything they can to care for the people, using compassionate use medications that are available, and providing the ventilatory support and what's needed to help that person recover. So it is a challenging element to it, and we do see a lag or a delay in the numbers as a result, and it's something that we'll continue to follow closely as we reopen the economy, with the hope that everyone continues the mask wearing, the hand washing, and the social distancing, because we know that works. We know it's effective, and that's going to be critical as we reopen the economy. Thank you.
Thank you very much.